Lilian Chihomoro has lived with HIV for 29 years. This social worker relied on life-saving drugs provided by the US government. But in January, President Donald Trump's executive order to freeze foreign aid caught her off guard.
I was given medication for 6 months, and the explanation was we are closing for now and we're not sure when next, so it's better you take this medication. And that traumatized me.
Last year, USAID had reserved about $4.2 billion for healthcare in the continent. And since 2003, the US President's Emergency Plan for AIDS Relief, PEPFAR, has invested most of its $110 billion in Africa. It used to cover all activities run by the Uganda Young Positives, which coordinates young people living unaffected by HIV and AIDS. But this 22-year-old community-based organization has had to reduce its staff by half and abandon its 2-year strategic plan.
We had envisaged also expanding our community dialogues in terms of educating the young people in treatment literacy. We can't do that anymore.
Many individuals who are working in critical support in Uganda have either paused or entirely moved on to new ventures. Quraish now spends more time here at his driving school business, unlike before the American aid funding cuts. UNAIDS says that the number of people using HIV prevention medicine has fallen by 64% in Burundi. And in Cameroon, HIV tests declined by 43% in the first 7 months of this year. African countries are prioritizing domestic financing to raise at least 15% of their budgets towards health. And the Ugandan government says it has signed a new $2.3 billion 5-year agreement with the Trump administration.
Previously, we were seeing a lot of financing going through third parties, and sometimes we would not know how much of that money has done some things in the country. But in the next phase of engagement, we are going to see more government being in charge.
This gives people like Lilian, who live with HIV, hope that they will continue to receive life-saving drugs. Darren Allan Kyeyune, TRT World, Kampala.